holiday season can be a particularly challenging time for managing our mental health. Between the stress of preparing for gatherings, reuniting with family while reminiscing on the loved ones we've lost, and changes to our daily eating and drinking habits, our mental health can take a toll during this time of year. The professionals at Mainline Health are focused on providing care that starts with making mental health a priority.
So mental health is important because it is a part of our health, and it's important because it affects every aspect of our lives, both big and small. It affects our sleep, it affects our relationships, it affects how we show up at work, how we are with our kids.
Mental health issues can manifest in physical ways, so it's important to check in with yourself.
So usually we become fatigued faster. We are not able to actually perform the duties that we usually do on a day-to-day that come easy to us. And we tend to get headaches a lot. And you can really see burnout a lot faster in that, the daily tasks we do become so much more strenuous.
Mainline Health offers comprehensive mental health treatment from a team of highly trained experts and physicians who value trust and create safe spaces for all patients.
Mainline Health offers a variety of services to treat mental health, starting with integrated primary care psychologists in most of our practices, and all the way up to inpatient psychiatry. We offer the full continuum of services.
It is never too early to invest in your mental health and seek treatment, but there are things we can all do on a daily basis to improve our own mental health.
Something that can make a difference in your mental health is sleep. We look at 5 or 6 hours of sleep as a badge of honor, but the effects of missing even just 2 or 3 hours of sleep every night is severely detrimental. It can impair the immune system, your cognition, your ability to learn, the ability to encode long-term memories, your attention, and can increase risk of poor eating habits, weight gain, cardiac events, and cancer. Invest time in yourself. We are all so busy and concerned with our day-to-day responsibilities that we neglect our basic needs. We need self-love, and the best thing you can do is set time aside in your day to love yourself, whether that be meditating, doing yoga, journaling, or clearing your mind and enjoying the sunset. The more we reset and calm the brain down, the easier it will be to handle the overwhelming amount of stressors that we face.
Hello, everyone. I'm Sarah Bloomquist, and thank you for joining us for this 6ABC Well Ahead Philly Town Hall, Managing Your Mental Health Through Connections, presented by Mainline Health. Mental and emotional well-being are integral to a healthy life. It significantly impacts all aspects of your life, including family, relationships, employment, leisure activities, and the basic satisfaction experienced from fully participating in life. Mainline Health has long been committed to serving the behavioral health needs of our community, offering comprehensive services that range from professional counseling for mood disorders to treatment for addiction to crisis intervention and so much more. With the holidays approaching, we will speak with clinical experts from Mainline Health to learn ways to maintain good mental health practices. Our topics will include managing mental health through making connections, managing life transitions, and preventing burnout. Let's say hello to our panelists now. First, we have Michelle Gallagher, a psychotherapist from Miramont Outpatient Center with Mainline Health, along with Shamir Holmes, also a psychotherapist with the Women's Emotional Wellness Center at Mainline Health. Also with us today, Linda Sterling Solomons, a pain management specialist, also with the Miramont Treatment Center with Mainline Health. Welcome, ladies. Thank you for being here with me today.
Thank you for having us.
So let's tackle this first topic, making true connections. In our hyper-connected world, when it seems like we can reach out to anyone and everyone with a text, tweet, or post, many of us still feel emotionally isolated. Forming authentic, supportive relationships requires introspection and some courage. So let's get to that first question. How can we make connections? Shamir, let me begin with you.
Well, I think it's important during this time of ongoing quarantine and hybrid living and working that making connections that are authentic and meaningful is incredibly important for all of us. Social isolation can definitely exacerbate feelings of anxiety and depression. And during this winter season, staying in touch with your family, your friends, your loved one are very critical things to do. just so that you know you have someone to share things with, someone who can express empathy, understanding, just some supportive listening. So whether it's social media, sometimes that can definitely be a powerful tool to connect us, or just keeping in touch with a FaceTime. And now that things are a little less restrictive and safer, going to see our loved ones as often as we possibly can, and as long as we're safe in doing that.
Michelle, let me ask you, because it feels like we're hyper connected, and yet why do people have such a difficult time making connections? We have Facebook, we have Twitter, we have texting, but why do people still experience those feelings of loneliness?
I probably see emotional isolation as root issues to mental health issues than anything else. And I think what it is there is a fear out there of showing our own vulnerabilities. A fear that when we connect with other people, our imperfections will emerge. And so why would we be afraid of showing our whole selves? And I think that fear is fear of judgment, fear of labeled, of being maybe gossiped. We've had experiences with this, and unfortunately, the world is not always emotionally validating to these feelings. Secondly, I think people are afraid of being misunderstood. And also they don't want to be a burden, to others. The problem with having all these sort of fears and apprehensions is that it makes us very guarded and self-conscious when we interact with people. And that's an enormous roadblock to making connections.
And tell me as well, Linda, what do you think? How does social media make it almost more difficult for people? You'd think it would help us be connected, but it's an element here that really seems to be complicating relationships, right?
Right. And what happens is that people put their best foot forward on social media. And if I look at it, and I know some people are really struggling, but when I look at it on their social media, they look like they have this perfect life. And I know for the young adults, teenagers, they're all about TikTok, and they judge themselves by other people and what they should wear. And that just creates more of a distance. In our addicted population, they're used to going 12-step meetings in person, and we're huggers, and you can't do that right now. So a lot of people are struggling because they can't get used to doing a 12-step meeting on Zoom.
Shamir, for you, what would you say to someone who's looking to reach out, to reestablish connections with people? We've all been so isolated over the last 20 months. What can you say to get people to really maybe come outside and really connect with the world again?
Yes, I think that's an excellent point. And when it comes to making those social connections and stepping out, veering out into the world, trying to establish some sense of normalcy and reconnectivity, I would encourage listeners and viewers to do what feels best for them. So whether it's baby stepping, maybe one family event this holiday season, or maybe it's just arranging one coffee date per month, taking your time, taking it at a safe pace that makes the most sense for you, but do test the waters to see how comfortable you are in re-engaging is vital this time of year.
Michelle, I think as well, when people, just a phone call, right? A phone call can make such a difference. We're texting and that can be misinterpreted. And seeing people face to face is such a different experience and healthy for us, right?
It is. And I think one thing to say, I agree with Linda and Shamir, on social media, we really are, it's like a self PR sometimes. It's like a brand, and we're not brands, we're people. And I think when we go to reconnect, over the holidays, either individually or with groups, I think what we want to do is not go into it with an agenda. You're not going into these spaces listing all of your accomplishments or achievements, but just go in with an open heart go in with, I like to talk about the 4 C's when relating with others, and that is, calm, curious, compassionate, and caring in conversations. And I think that, if we present like that, it will naturally unfold. Deeper connections will not unfold.
Linda, for you, what about the empathy part of this? I always say to myself, everybody's got something, right? Everybody has something going on in their lives. And when you're looking at others, don't you think right now, Michelle used the word compassion, as we're looking to help others, isn't that so important, especially during this time?
Absolutely. As a nurse, I'm okay with saying I'm not perfect. And it took me a long time to be okay with not being perfect. And I think when we're authentic with our feelings, it allows people the space for them to be authentic with their feelings. And it's okay to say, I don't have all the answers, but I do know who to call in those cases. And I think people are struggling with reaching out for mental health help at this time.
Let's get to our next topic now, and that's about transitions. And we talk about people switching jobs now. A lot of people moved during the pandemic. Transitions can be both exciting but also challenging. While changes can be refreshing, a transition can get in the way of the comforts of daily living. A large-scale transition like a breakup, a job change, becoming an empty nester, or a move may have a different effect on our life than a small one. And learning to deal with transitions is very important, as our busy lives are almost always changing. Shamir, why do people struggle with transitions? Why is it so stressful? And what can you do to help make those transitions less stressful?
That's an excellent question. I think while change is undoubtedly this inevitable part of our everyday lives, dealing with change and simply acknowledging that is rarely ever easy. So we tend to be creatures of habit naturally. And if given the choice between our daily routines, the things that we're so accustomed to and used to, or stepping out of our comfort zones, most of us are going to lean toward whatever is familiar. Change requires adjustments and a lot of recalibration. And even if it's a good change, something positive, something that's wanted or anticipated, it can still be extremely stress-inducing. So if changes and transitions will lead to a hiccup or a disruption to your everyday life, then chances are that stress, feelings of anxiety, feelings of depression will all soon ensue. I think the best way to handle the change is to lean into that discomfort and to know that it's inevitable, to make some sort of plan of action and prepare yourself as best as you possibly can, having open and honest conversations with loved ones in the event of an emergency or financial crisis or something difficult coming your way. You want to always be somewhat prepared as best as you can for changes that are seen as well as unseen. And I think another way to safeguard our mental health during times of major life transitions and changing is to stick to a routine. So whether that's eating healthily, exercising, staying hydrated, getting as much rest at night and sunlight as much as possible are all valuable tools to safeguard your mental health and allows you to healthily handle that change as it comes.
Michelle, for you, with the patients you're seeing, have you found a lot of people have really reevaluated their lives right now and are making a change? And sometimes that doesn't have to be a scary thing. It can be a very good thing. Maybe right now a job shift is the right thing to do, or moving to a different home and a change of scenery. Have you found that with the people you're seeing?
I have, especially, I have to say, with the adolescents and young adults that I work with, it was a big change for them to go back to school. And there was a lot of trepidation and fear. They became, in a sense, out of shape with socializing and connecting. And so all of a sudden they're in this brand new, not really new, but new after a certain period of time, environment again. And it was very, very frightening to them. And I think to acknowledge, just as a therapist, to acknowledge those fears and that they were real, and let's take those baby steps. And also, to do those consistent routine things that kind of keep us grounded, even in a time where our world seems very, very volatile.
Linda, I've been feeling too, just in my own life, that I call it the hamster wheel. We're running every day, and the weeks feel long these days, I think. Our days are full. It's just a strange time. When people are making these transitions, you're a pain management specialist, so what advice would you give to people about staying calm and pushing through a transitional period in life?
Well, in my own life, whenever I've been in a transition, I relate all my besties, all my girls. So I would say, get a good support system. I have a girlfriend, I call her my cheerleader, and I will call her when I think, I can't get through this. This is too hard. And she'll say, you've been through worse, honey. You can do this. You got it. You got this. So having someone who has, quote, our back and reminds us, that knows us well and reminds us that, this is temporary. The discomfort is temporary. And we have to embrace the discomfort and just know that it will be better.
Shamir, are you also talking to patients and talking to people about making transitions at this point in their lives? People are doing things differently, right? And how are you guiding them through that?
Absolutely. So the amount of wonderful women that I get to counsel and assist at the Women's Emotional Wellness Center, they are negotiating a variety of new norms. And one of the things that I like to promote within my mental health counseling approach is being as proactive as possible at this time. Being proactive versus reactive makes all the difference. And it could be something as simple as changing the way that you think and being mindful of your state of mind, a little bit of hope and optimism with whatever the change is, whether it's navigating staying remote full time or having to go back into the office on a part-time basis. The way that we look at things makes an incredible difference. And I also encourage women who the research show are 49% more stressed than their male counterparts, is to really know the signs and symptoms. It's never a bad thing to reach out to a mental health professional, a provider, if your symptoms are on the uptick. So if you're feeling not like yourself, maybe there's an increase of feelings of sadness, isolation, irritability, trouble sleeping, difficulty concentrating, then these are all telltale signs that it's time to reach out and maybe get additional supports to navigate the changes, but really leaning in. And when our perspective changes and we try to approach it as positively or as optimistically as possible, chances are the transition and the major changes that we're looking at, be it having the kids return back to school or what we're going to do with our own professional careers, those things that we're dealing with head on will change as well.
Michelle, we are a panel of women here, so let me ask you, do women handle this differently? I mean, on a personal note, I know for me, I want to be in control of everything, and I have to admit to myself from time to time, I simply can't be, and I have to delegate. Is that typical of women?
Well, I do think women, and not to be really stereotypical here, but I do think we struggle a little bit more compartmentalizing things. And sometimes we really have to do that. It's very, we just simply have to emotionally regulate. And, sometimes our emotions are all over. I do think men are a little bit better at compartmentalizing, not everybody, but I think sometimes we have to, it will help us to compartmentalize a little bit. That's.
Linda, do you feel the same way? What can you say for women who are watching this program to help them manage this difficult time? I know for many women, a lot falls on you, taking care of children often, doing a lot of the shopping. How is this a different experience for women in your mind?
I think with everything with the pandemic, everybody's stress level in general is up a notch or two. So I think the holiday stress and everything we have to do around that is actually much higher than it's been in other years. For me, in the past, I've had to say, what can I take off my plate? How important is this? All right. And I gave up making Christmas cookies a long time ago. And, I get them from other friends who love to bake them, and I do something for them. They hate to wrap. I love to wrap gifts. So once again, leaning on others, and also to make sure you make time for yourself. If you're giving from an empty or a low battery, you're going to burn out really quickly.
Let me follow up with you, Linda, because again, you are a pain management specialist. Can you give us some tools to calm our stress during a time of transition? Some actionable things we can do?
Absolutely. The number one is stop and breathe. Take a breath. Because once our anxiety gets really high and the stress level gets high, it's hard to make decisions. So if we can step back and say, how important is this? And then making time for ourselves. So I recommend, especially working moms, get up 15 minutes earlier than they do and have a quiet cup of coffee. Read something inspirational. Write a little journal. So if we start our day running from the get-go, our whole day is going to be playing catch-up. But if we invest that 5, 10, 15 minutes in the morning, then we're going to start the day calmer. And I do have a simple meditation that I've been teaching the patients here, and they love it. And it's called the 5-word meditation from Think Like a Monk. I do have the book here. And the words are calm, balance, ease, stillness, and peace. So I set my Apple Watch to 1 minute. So I think of each word for 1 minute, and then it buzzes a little, and I reset it. And it only takes 5 minutes. And next thing you know, I'm calmer. I actually used this in a doctor's office when I was getting stressed. And I just got to the first 2 words, which were calm and balance, and in came the doctor, and I was calm.
That's such great advice, something we can actually do in the moment. Shamir, how about for you? Maybe you have some tools of your own.
Yes. And so in a lot of individual therapy as well as group therapy settings, I also am an advocate of mindfulness. So mindfulness and meditation, we offer a variety of outpatient therapy groups that I strongly encourage all of the women to participate in. It's a 90-minute treat for themselves each week, and it's facilitated virtually online through our Emotional Wellness Center. And I think knowing the signs and knowing the symptoms is key, just really tapping into yourself and being real with yourself, because every woman is most likely to experience more or greater physical and emotional symptoms that are related to stress that comes from a lot of change and transitions than our male counterparts. So asking for help, taking quiet time, trying some mindfulness, meditation, having a gratitude journal is something that I speak with a lot of clients about, and just taking things, at a healthy pace is usually helpful.
Michelle, what advice would you give to our viewers today to take a breath and get control of the situation and let themselves know you're okay, right?
I couldn't agree with these ladies more. I mean, this is so imperative. I go through a body, mind, soul checklist every day to see how I have tended to each. And I'm very, very big on a daily, prayerful meditation in the morning, come hell or high water. I mean, everything can be falling apart, and I am in that chair with my meditation. And then I really check into the physical. How's my body feeling? What have I done? What kind of exercise? So I think to have that checklist like that is just really so important.
Let's move on to our next topic. If constant stress has you feeling disillusioned, helpless, and completely worn out, you may be suffering from burnout. When you're burned out, problems seem insurmountable. Everything looks bleak, and it's difficult to muster up the energy to care, let alone do something about your situation. So many people feeling burnout right now, especially as we get to the end of the year. Linda, why do you think people are feeling this way? And what are we talking about when we talk about burnout?
So burnout is chronic stress, and it's really known more for workplace stress, but it can be family stress, school stress, everything. And it's a buildup that's happened over time. And sometimes it's so insidious. And then one day you go, I have nothing else to give. And the term was actually coined in 1974, a Herbert Fredenberger, a psychologist. So it's kind of, I don't know, maybe a relatively new term, I'm not sure. But we know that chronic burnout really has a lot of physical effects. And number one, it puts you at risk for diabetes, high blood pressure, heart attacks, and also decreases your immune system, which is something we don't want in this pandemic. We want to keep our immune system as high as we can. And the number one symptom of burnout is just feeling exhausted, mentally, physically, and emotionally, and irritable. And I was talking to some staff at lunch yesterday, and my one coworker, she said, I knew you were burned out because you snapped at me. And you never snap at me. And I was like, oh. So sometimes when we look at our loved ones, we might notice they're a little off. They're not quite themselves. And then maybe just reach out a little bit more and see what's going on underneath all that.
Shamir, for people watching, what can they look for? How do they know to get ahead of this, that they are approaching burnout? And what's the difference really between just feeling everyday stress and being burned out? There's a couple questions in there.
Well, I think it's definitely, again, my one motto of knowing the signs and knowing the symptoms. There are physical signs and symptoms of burnout, as well as emotional signs and symptoms. And then again, there's behavioral signs and symptoms. So with the physical component, if you're feeling tired or extremely drained most of the time, and this is not your baseline, that's a warning sign. If you're experiencing frequent headaches, joint and muscle pain, perhaps there's a major change in your appetite, your sleeping habits are disrupted, and you might be suffering with lowered immunity or frequent illnesses. The chances are that physically your body is trying to tell you something and it's time to pay attention. With emotionality, if you're having a sense of failure, a sense of doubt, you've lost overall motivation, there's increasingly cycles of a negative outlook. You're one of those people who feels as though every day is a bad day and you're just at your wit's end. You don't have the margin for your own challenges or to-do list, let alone a friend or a loved one's. And if there's a decreased satisfaction for a sense of accomplishment, you're feeling detached, you're feeling all the more alone, and this isn't typically how you feel, symptoms of being trapped or defeated is probably several of the warning signs that emotionally you're burnt out. And then I would say with our behavioral health, if you're purposely and intentionally isolating from others, you're using food, maybe recreational drug use, alcohol to escape or to numb some of the pain and the feelings that you're experiencing. These are definitely signs that you have to pay attention to. And if you're overall withdrawing from your daily responsibilities, procrastinating, really struggling to get tasks done, skipping out on work commitments, social commitments, wanting to arrive late but leaving early, your behavior isn't typically like this, then the chances are you are struggling from some elements of major stress and burnout. And I would say that stress, by and large, is just having way too much on your plate. It's the demands of everyday life and the pressures that we face both physically and mentally. Burnout, on the other hand, I would say is probably a bit more fatigue and extreme that you're going to need to purposely kind of work toward gaining some rest and a sense of balance to put things in proper perspective, take time out for yourself, really step away from the situations at hand that are causing the burnout in order to improve your physical and your mental well-being.
So Michelle, I sort of feel like if we had a viewer here in the room with us, they might say, yeah, that's all well and good, but this is my job, this is my family, these are my bills, this is my responsibility. How do you reevaluate your life to get control of that again and avoid burning out completely?
It's so difficult. And I think a really important word here is boundaries. We have to have boundaries. I especially see this with caretakers who really struggle with compassion fatigue. I know as a therapist, I certainly have to take care of my, self-care in that area, because it's our job to be compassionate. And I think that's the same, case with parents, let's say. And then when they're children, I especially see with, teenagers and young adults, and the parents are just, I had a patient say to me the other day, my gas tank is simply empty. I have nothing to give. And so clearly she had compassion fatigue. Her daughter was struggling and she had compassion fatigue. But she needs to set up her own boundaries. I think boundaries are so important with burnout. And I also see it with students who are real high achievers. They're beginning to burn out, just especially the seniors that I have that are now looking at colleges and things like that. And it's physically, like Linda and Shamira said, it is absolutely physically affecting them. And it's just get back to that, get back to that breathing, get back to that, kind of meditative mindfulness, to just take a break, to care for the self and set up those boundaries. Do not feel guilty. We need some self-preservation.
Linda, you had talked about turning to your besties. I think, ladies, there seems to be this common theme here in that you really can't do this all on your own. You have to reach out to others. And even if that's a conversation with a boss, to say, I need a little time. I'm not doing so well right now. Can I have some time? And really, would you agree, Linda? We're talking about making connections. You've got to use those connections, right?
Exactly. And, I think the other thing is we want to do it perfectly. We want to have a perfect holiday. We want our kids to look good. We want our homes to look good. We want to give a home cooked meal. That's a lot of pressure that we put on ourselves, And what I say to people is lower your expectations for a little bit. You don't have it to give. And I say to people, your cell phone, we plug them in every night, do we not? So why don't we recharge our battery every day? And for everybody else, that's different. I get a monthly massage and I go in there and I think I'm good. Oh no, I have so many knots, but I thought it was good. So it's a good mental check-in for me to see where I'm storing my stress and how stressful I really am.
Shamir, I know for myself, sleep matters a lot, right? In all of this, doesn't that factor in as well?
Yes, sleep hygiene is key. I know that according to the medical experts, the recommended amount is anywhere from 7 to 8 hours per night if possible. Sleep can make or break your psyche, your emotional and your psychological well-being, as well as balanced nutrition, consistent and regular exercise, and really just connecting with our besties and our social connections is so vital.
Kindness is the word that also keeps coming to my mind, right, Michelle, in terms of being kind to yourself and kind to others. We have such a charged dialogue happening in the country right now. There's a lot going on, but if we could just get back to being nice to ourselves and to each other, it would go a long way.
Mm-hmm. Absolutely. Absolutely. And one other thing I'd like to just add on about the sleep. I think our days are so busy and, they're so hectic oftentimes. And then we feel, an hour comes and then we feel like we just have to go to sleep and then it doesn't work, or we wake up in the middle of the night. But I think we honestly have to prepare for that. When the cell phone gets turned off at an early time or a reasonable time, you have to sort of fall into sleep, right? That's what falling asleep is. And I think we have to fall into that. So it takes some preparation to actually get to a good place where you're going to have a restful night.
We're coming to the end of our time here, but let's do a quick round robin. Linda, let's begin with you to wrap this up. Why do you think this is such an important topic, and why is it so important to make connections and to really keep in check with yourself? Why don't you begin?
I would say with the pandemic, we thought it was going to be 2 weeks, and now it's 2 years. So I think we're all a little bit worn out. And when we don't have control over things, then we get even more stressed. So control the things you can control, and that is the way we think, the way we act, and the way we treat ourselves and others.
Jamir, any final thoughts from you?
I would say that the bottom line is that when we try to avoid life's changes and the many transitions around us, stress might be reduced momentarily. There's a temporary win or a gain, but as the research implies, it actually increases our stress levels in the long term. So leaning into change and transition is important. Practicing self-compassion, really taking a step back and adding ourselves onto our priority list is key. And I want people to remember that mental health matters because our mental health is our total health. And mental health encompasses so many of the things that we discussed this morning: emotional, psychological, social well-being. And mental health is important at every stage of each of our lives. It largely determines just how well and how healthily we can actually handle the stress that is presented to us from the changes and the transitions.
And Michelle, we'll conclude with you. What's your final takeaway for our viewers today?
I think the takeaway from me would be that mental health matters as much as physical health because it's part of the human condition. It is something that we all share that connects us. And honestly, I think we would all agree that the stakes are high these days. And, to be caring and compassionate to others and also to ourselves, it, unfortunately, but truly has become a life or death situation. So it's extremely important to always have tabs on our mental health and to not be afraid to connect with others as much as we can, because when we socially isolate, we stay in our heads. And I think we would all agree that staying in our heads sometimes without a barometer, or we lose perspective. And that can be very, very dangerous because we're caught up in our own narratives. But connecting with people can prevent that.
Yeah, and I think too, when people are working from home, that makes it all much more difficult too. And I know I worked from home for about 5 months and I was in my head. And it does help to reach out, to make connections, to be in touch with people, to communicate. Ladies, thank you so much for being with us. I've really enjoyed our conversation today. It's so important. I feel like we could just continue talking, but we'll do it again another time. Enjoy the holidays ahead. Thanks to our panel so much for giving us the resources to take care of ourselves, especially during the winter months ahead. I want to give you 2 quick resources: 6abc.com and Mainline Health .org/wellaheadphilly. You can go to those for additional information, and we really have some tools here, and you'll find some resources there on those 2 websites. From all of us here at Action News, I'm Sarah Bloomquist. Stay well.